Hi, I'm Dr. Dan Mastella. These are the Joint Jack Chronicles. Peak reaction. Hi, this is the Joint Jack Chronicles. Today we're going to talk about a phenomenon called peak reaction. Anytime there's a wound or surgery, particularly in the hand, there's a normal healing process that occurs. About 6 weeks after surgery or 6 weeks after a significant wound is made, particularly in the palm, there's a significant fibrotic reaction that we call peak reaction. It's important to know about this for both physicians, therapists, and patients, as it can be a really disturbing time for the patients after they've had surgery or after they've had a wound. In particular, there's worries about infection, recurrence of the problem, an increase in pain, and all of this is part of the normal healing process as collagen forms in the hand. It's a relatively simple idea, but a very important one as the patients are really disturbed about this time. This is one of the key follow-up visits for us post-surgically. We'll see patients at 2 days for dressing change, 2 weeks for sutures, and then at 6 weeks, because that's when they're the most disturbed by the peak reaction findings, usually finding that their symptoms are worse than they were even at 2 or 3 weeks post-op. The time frame is always the same, somewhere between 4 and 8 weeks post-op. There's a little bit of variability, and it typically peaks at about 6 weeks. The phenomenon is peak reaction, and the reason for it is biologic. If we look at formation of collagen after wounding, as time goes on, there are 2 phases to collagen healing, which is well known. The initial stages of healing we're not so concerned with, and that has to do with stopping bleeding and control of the acute wound. About 2 weeks into healing time, collagen formation begins. The initial type of collagen in any wound is type 3 collagen. Type 3 collagen starts forming not long after, but in a significant way at about 2 weeks. And this starts to increase as time goes on. It will come and start reaching a maximum at about 4 weeks post-op. About the same time, type 1 collagen starts forming in the wound, so that you get a conversion of type 3 collagen to type 1 collagen, which is the predominant collagen type in scar tissue. As that starts up at about 4 weeks, it will start increasing in terms of its content in the wound. At about 6 weeks from the time of wounding or injury, these 2 types of collagen cause a maximum amount of collagen formation in the wound, maximum amount of irritation with redness, tenderness, and warmth in the wound because of the amount of metabolic activity. As time goes on, the type 3 collagen starts getting resorbed and the type 1 collagen starts to stabilize for final wound healing. But right around 6 weeks' time is when this process is at a maximum. There's collagen crosslinks happening in the type 1 collagen, the type 3 collagen is getting resorbed, and overall you have a high level of metabolic activity. For the patients, clinically, this means redness, swelling, and pain, and at a time when they really thought they were about over their post-operative pain. It's a concerning time for the patient, and with an explanation about the biologic basis for it, we can easily explain to them that this is a normal phenomenon and that it will go away over time. Thanks.